Dr. Cherot, you are recognized for 5 minutes for your opening statement.
Good morning, Chairman Guthrie, Ranking Member Eshoo, members of the Health Subcommittee. My name is Dr. Elizabeth Cherot. I am Senior Vice President and Chief Medical and Health Officer at March of Dimes, the leading organization fighting for the health of all moms and babies. Our work today is more important than ever, with the nation in the midst of a dire maternal and infant health crisis. By improving the health of women before, during, and between pregnancies, we can improve outcomes for them and their infants. But we have many challenges. Recently, the CDC released its 2021 maternity mortality rates report, which showed an increase of nearly 89% in the maternal mortality rate since 2018. At the same time, the number of women who experience pregnancy-related complications or severe maternal morbidity is increasing at a troubling rate. The state of infant health mirrors that of maternal health. While the most recent preliminary 2022 CDC data on preterm birth shows a 1% decline in preterm birth rates, 1 in 10 babies are still born too sick and too soon. This small decrease, while promising, only highlights the need to redouble our efforts. What's more persistent, racial disparities exist. Black and Native American women are 62% more likely to give birth prematurely, and their babies have a mortality rate double that of the white population. Let me share one of the stories from my full testimony that exemplifies the experiences faced by mothers who deliver their babies prematurely. Katie Wilton of Phoenix, Arizona, began facing life-threatening complications 22 weeks into her pregnancy when she began hemorrhaging. During the next 8 weeks, she suffered 2 more bleeding episodes, and at 29 weeks and 2 days, Katie found herself in preterm labor. When she arrived at the hospital, she was given treatment to slow her labor and prepare for Colette's early arrival. As Katie was soon to learn, she was experiencing chronic placental abruption, where the placenta prematurely separates from the uterine wall. When Colette was born at exactly 30 weeks gestation, she was diagnosed with severe intrauterine growth restriction. She weighed only 3 pounds, 1 ounce, and measured a mere 14 inches long. During her 63-day stay in the neonatal intensive care unit, Colette was given life-saving medication. Among them was surfactant therapy, a treatment to advance lung development, which was developed by the March of Dimes funded research. This story and hundreds of thousands of others each year, just like it, highlights the need for us to do more. To that end, March of Dimes supports the following legislation being considered by the subcommittee today: H.R. 3226, the Preemie Reauthorization Act of 2023, which represents the federal government's commitment to preventing preterm birth and its consequences. This legislation specifically reauthorizes CDC's highly successful Pregnancy Risk Assessment Monitoring System, or PRAMS. PRAMS collects site-specific population-based data in 50 jurisdictions, tracking maternal attitudes and experiences before, during, and shortly after pregnancy. The Act also reauthorizes the Health Resources Services Administration's HRSA's activities aimed at promoting healthy pregnancies and preventing preterm birth. And it provides a new study by the National Academies of Sciences, Engineering, and Medicine, which will examine the societal costs, the impact of societal factors, and gaps in public health programs related to preterm birth. March of Dimes also supports H.R. 3838, the Preventing Maternal Deaths Reauthorization Act of 2023, which strengthens and expands federal support for the Maternal Mortality Review Committees, MMRCs, established under the authorizing law enacted in 2018. MMRCs play an invaluable role in identifying maternal deaths, analyzing the factors that contributed to maternal deaths, and translating the lessons learned into policy. They have revealed that cardiac-related issues are the leading cause of deaths for mothers, and that the majority of deaths do not occur during childbirth, but in days and weeks after. This legislation would continue to disseminate best practices and help MMRCs promote the case review process. Thank you for focusing your attention on these 2 public health crises. March of Dimes stands ready to to work with you to enact this critical legislation.